Okay, we're going to go ahead and get started. My name is Angie Anderson. I'm the Respiratory Disease Program Coordinator at Sarasota Memorial. Today we have Laysa and Michelle, who are both pharmacists here at SMH, and they're going to be walking us through medication management, how to take inhalers, and provide lots of information on how to manage COPD symptoms. So I will let them take it from here, and then we'll have some questions at the end. But Lisa's going to take us through this PowerPoint, and then we'll do the questions at the end of the presentation.
All right, thank you.
Thank you for coming.
Thank you for having me. So my name is Laysa Vasquez. I am a pharmacist. I'm actually a PGY1 pharmacy resident here at Sarasota Memorial Hospital. And today I'm going to be taking you through a lot of the inhalers that are used in COPD or chronic obstructive pulmonary disease, as well as these are also used in asthma. So my presentation is called Breathe Easy. And this is to help you hopefully get a better understanding of how your medications are supposed to be used and some other pearls of wisdom. So let's get started. So if you look at the screen, I'm sure that you've seen most of these inhalers before. Usually patients are prescribed 1, 2, or 3 inhalers or 5 inhalers. I mean, not usually 5, but this is just to kind of show you how many different inhalers are available. And as you can see, it can be a lot, and there are a lot of different kinds. The reason why I'm doing this is to hopefully just give you a better understanding of the inhalers, how to use them, and to just kind of categorize the inhalers so that you know how they're used and what they're used for. So the goals of medication management, the goals of these medications for patients who do have COPD or asthma is to help with your lung health. So as you know, COPD, it's a progressive disease, but if you use your inhalers appropriately, then you can have better lung health, which would obviously help you in your day-to-day activities, such as going to work, which I guess now because of COVID, we're mostly working from home. So, but you'd still be able to talk like with your peers, with video chatting a lot like how we're doing right now, or just live your life, your day-to-day life, whether it's running or going outside or dancing. That's the goal of the use of medications, just to help you live your life as normally as possible. So when we talk about inhalers, there's a couple different types of inhalers. The first one I'll talk about is a class called bronchodilators. And what bronchodilators are, broncho means lungs and dilate means to open. So these medications open your lungs and they make it easier for you to breathe. They relax your muscles so that you can breathe easier. When we think about bronchodilators, the technical name of this is a beta-2 agonist. I'm not expecting you to remember that. It's just mostly for your knowledge. These are typically your rescue inhalers, and they work in about 3 to 5 minutes. So this would be your albuterol inhalers. You might also hear it called ProAir or Ventolin, or your lev-albuterol inhaler, or your Xopenex. These you use every 4 to 6 hours as needed. These inhalers are not meant to be used every single day, every 4 to 6 hours. If you do see that you are using your rescue inhaler a lot or more than what is needed, then that would be kind of a red flag for you to go talk to your doctor and see about maybe changing up your therapy a little bit. So these you would use before you work out, before you exercise, before you do any type of activity that makes it hard for you to breathe. This is very fast acting. So the next category, well, these are still bronchodilators, but these are more of your long-term use medications. So these are called maintenance inhalers, and they usually, you take them at least once or twice a day. And some of the inhalers, we have the Arcapta inhaler, which you use once a day. The Striverdi inhaler is also once a day, and the Ceravent, which you use twice a day. This is not an all-inclusive list. This is just mainly the inhalers that I see most commonly. Our next class of medications is called anticholinergics. And these are very similar as far as being a bronchodilator, similar to the beta agonist. And there are also rescue medications, but they take about 15 or so minutes to work. Excuse me. The most common one that we see is ipratropium or Atrovent, as you have pictured here. As I mentioned before, this is a type of medication that you would take before you do any type of strenuous activity or any type of activity that causes you to become short of breath. That's what these inhalers are for. And then we also have maintenance medications in this class of medication. So we have the Seebri, the Turdoza, and Spiriva. As I mentioned before, this is not all inclusive, but these are some of the more common types of anticholinergic bronchodilators that I would see. So whenever you're escalating your therapy, you would usually get a combination of a beta agonist and an antimuscarinic. And this is because you don't want to have 5 inhalers and, you know, kind of have it jumbled all over the place. It just makes it a lot easier for use. So you have your Stiolto, which is a mixture of your tiotropium and olodaterol. So that is that beta blocker and your anticholinergic coming together in one form. So that way you don't have to take 2 separate inhalers. That is a maintenance. This is a maintenance inhaler and it's used once daily. You also have your Combivent. Typically, this is a combination of 2 short acting, which is the antimuscarinic and the beta agonist. And this is typically used as needed, usually up to 4 times a day. And then you also have your Anoro Ellipta, which is your umeclidinium and vilanterol. That is also used once daily. So the medication in the middle is for rescue and the 2 out on the side are for maintenance. As I mentioned before, if you're using your rescue too much, then that would be a sign to call your doctor, and then they might prescribe you one of the ones that I mentioned, like the Stiolto or Anora, to help better manage your symptoms. So every now and then, for patients at least with asthma, they would prescribe steroids. Typically, patients with COPD would not be prescribed an inhaler that has a steroid, only because it can possibly increase your risk of infection. That's not absolute, but that's just what's been seen in a lot of different studies. But that's not to say that patients with COPD do not have inhalers that have steroids in them. So another name for this is called inhaled corticosteroids. And how they work is they reduce swelling in the breathing tubes. These are not anabolic steroids, so there's no need to concern yourself with, you know, side effects of anabolic steroids. But I will say that one of the side effects of using this medication is you can possibly develop thrush in your throat if you do not clean your mouth out after using a steroid inhaler. So something that's very important is whenever you use something like a Symbicort or Flovent, you want to make sure after your dose to rinse your mouth out thoroughly to kind of get any of the residue in your mouth out, so that way it doesn't just build up and then you end up developing a fungal infection. So one of the newer inhalers that's come out recently is called Trilogy. This is a combination of all 3 classes of medication. So it has fluticasone, which is your steroid, umeclimidium, which is your anticholinergic, and vilanterol, which is your beta blocker, and this is used once daily. You would see this inhaler mostly for more advanced stages of COPD, and it's a newer formulation. So, but I honestly think it's pretty great because then you get basically the benefits of 3 inhalers all in one. So, and with this one, because it does have the steroid in it, you want to remember to rinse your mouth out thoroughly. So something that's really important with COPD is managing your symptoms and your medication. So the pharmacies have a lot of refill programs at like your community pharmacy. So that would be something to inquire with your community pharmacist about that. Another way to, another way to help is to have a calendar or alarms on your phone to maybe mark down how many times you used your rescue inhaler that day. And then you can count up throughout the week and see how many times you've used it, and you can report it back to your doctor so that they can assess how often you're using it and whether or not you need to go up on your dose or whether or not they need to change your therapy altogether. You can set alarms for your maintenance medications so that way you can remember to take them. Another way to remember your dosing is to keep a diary. So you can always use a diary to document what type of symptoms you had that led up to you needing to use your rescue inhaler and how many times you've used your rescue inhaler as well. So you can report this back to your pulmonologist or whomever manages your inhaler medications. So those are just a couple of different strategies to help you manage your medications and your symptoms better. So I know the big question is, does my insurance cover this inhaler? So I'm sure most of you know that the inhalers can become a little bit pricey after a while. So it's important for you to reach out to your insurance company and they can tell you what's on their formulary. The formulary is basically a list of approved medications that the insurance will cover. So it depends on whether or not it's brand or generic. I know recently within the past couple years, inhalers like ProAir or Ventolin have gone generic and now it's just albuterol. That usually makes it a little bit cheaper. Same thing with like your Advair and your Flonase have become generic in the past couple years. So that usually helps to decrease the price. And you can also use GoodRx coupons. GoodRx is actually a really great resource to utilize. You can just go to goodrx.com. Usually your doctor's offices would have these GoodRx coupons as well. For example, if you get prescribed an albuterol inhaler and your insurance comes back for some reason, it's like $50, then you can use a GoodRx coupon. And usually the price ranges between $18 to $31, depending on which pharmacy you go to, because the price does change when you go to different pharmacies. So just remember to keep that in mind. So one of the common things that happens with COPD, unfortunately, is exacerbations. An exacerbation is a worsening of your COPD symptoms. So it's usually when you have a really hard trouble breathing and your rescue inhaler is just not cutting it at this point. And you might end up having to go to the doctor and they might end up prescribing you something else, maybe prescribing you some steroids or an antibiotic, or if it's bad enough, you might need to go to the hospital. So it just depends on how severe your symptoms are. Will determine whether or not you just go to the doctor or go to the hospital. So as I mentioned before, when you do have an exacerbation, you would get a couple different types of medications. Usually when you come in, you would get some oxygen. So let's say theoretically, you're having a really bad exacerbation and you have to go to the hospital. It's not always the case, but in this case, let's just use it as an example. If you are not getting enough oxygen, then obviously they will supply you with supplemental oxygen. Sometimes with COPD or asthma, you would be at increased risk, sometimes for infections. So you might get some antibiotics to treat for pneumonia, just in case you have pneumonia. So we have antibiotics like pictured here. We have the Z-Pak. That's the most common antibiotic that I see prescribed for these patients. And that's the one where you take 2 as a first dose, and then you take 1 tablet thereafter. You might also be prescribed steroids. So usually your prednisone or your methylprednisone, those packs, which are the ones that come they come in a pack, you take it for 6 days, and it's usually 6, 5, 4, 3, 2, 1 tablets. And that's just how the taper works. If you're in the hospital, you'd most likely be prescribed IV medications, because if you're having trouble breathing, then we don't want to put anything in your, down your throat. It looks like I have a raised hand. Does somebody have a question?
Can you hear me?
Yeah.
Yeah, not yet. I'm trying to get the video. So
Okay.
I'll stay with you.
Okay, no problem. I'll continue. And just let me know if you need anything.
Right.
So as I mentioned before, in the hospital, whoops, I clicked too early. In the hospital, you probably get IV antibiotics and IV steroids. So, additionally, you'd also get nebulizers, which usually a nebulizer, I'm sure maybe most of you have seen it, but if not, it's a little packet that you put in a machine and you put a mask over your face and it just kind of cycles through the medication so that it gets into your lungs. Some prevention strategies that we can use to hopefully help prevent exacerbations more often is smoking cessation. Smoking cessation is big on as far as like decreasing your chance of having an exacerbation. You can also get immunizations. There are certain types of immunizations that are recommended by the CDC or the Centers for Disease Control. And those are usually like your pneumonia vaccine, making sure that you get your annual flu vaccine. And there's some other vaccines that they also recommend just to help decrease your chance. But mainly the pneumonia is also a very important one. So if you have any questions about how to get these immunizations, or if you want more information about smoking cessation strategies, I know here at SMH, we have like a smoking cessation type of education, or you can just go to your doctor and they can give you more information about that. So now I'm going to demonstrate how to use some of these inhalers because it's important to have good technique so that you can ensure that you're actually getting the dose of your medication. So I'm going to stop sharing my screen for a second so that you can see how I demonstrate. Hold on. I don't know.
I think we can still see it,
Okay.
but it's not big on the screen. So
I think I just clicked this. There we go. Okay. All right. Okay, so the first one I'm going to demonstrate is just your typical puffer, or this is called a metered dose inhaler. This is usually how you would see like your albuterols or your Dulera inhalers. And I'm going to show you how to assemble it and how to use it. So whenever you get the package, sometimes it'll come disassembled like this. This is the canister and this is the actual puffer device. So what you're going to do is you're going to make sure to look at the product and make sure that you can see the expiration date. It's also important to make sure that your product is in date, because if it's not in date, there is a chance that it might not work. So always check your expiration dates whenever you get your inhalers. You're going to take this narrow end and you're going to insert it into the empty space in here like this. And then when it's your first time using the inhaler, or if you haven't used the inhaler for a very long time, it's very important that you do something called priming. And what priming is just, it just gets the medication going in the canister so that you don't just get air and you get actual medication. So what you want to do is you want to shake the inhaler, and then you want to point it away from you. And you want to do this maybe once or twice just to get the medication flowing. And then the way that you're actually going to take your dose is that you want to make sure to exhale fully so that your lungs are empty. And then you want to form a tight seal around this mouthpiece. And then once you form a tight seal like this, I mean, I'm not going to put this as fake medicine, so I'm not going to put it in my mouth, but you're going to form a tight seal. And then at the same time, you're going to press the top part of the canister so that the medication comes out inside of your mouth while simultaneously taking in a sharp breath so that you get the medication inside of your mouth. And then you're going to turn away and hold your breath for at least 10 seconds or for as long as that is comfortable. And if you prescribe 2 puffs, then you just want to repeat those steps. And that's pretty much it. That's how you use these inhalers. And you just want to make sure to keep it out of reach of children, obviously. Don't put it in the fridge or anything like that. And just store it at room temperature, cool, dry place. All right, so the next type of inhaler that I'm going to demonstrate is this. It's called a discus. And the discus, you would usually see your Advair. Typically, the Advair inhaler is the most common that uses this one. So I'm going to show you how to use it. One thing that's very important is this is a dry powder that is inside of here. So it's not like this medication that comes in a canister. It's very important that when you load, which I'm going to show you in a second, when you load the medication, not to turn it, because then you're going to lose your dose. So the way that this works is you want to, I kind of liken it to holding it like a hamburger. So you kind of want to hold it sideways like this. And then when you look here, there's like a slot for your finger, and then you just want to open it. So when you open it, you'll see this mouthpiece, and then you'll see this little lever thing. This lever activates the dose. So as I mentioned before, hold it like a sandwich, pull it all the way back until you hear a click. Hopefully you heard that click. And then once the dose is activated, you want to form a tight seal. Do the same thing that you did with the MDI inhaler. Exhale all of your breath, form a tight seal around this mouthpiece. And then you want to hold it, like I said, like a sandwich. And then you want to inhale very sharply so that you get the full dose of the powder inside of your mouth. Once you're done, if you have to take a second dose, then you just want to repeat the steps that I showed you before. Something that's really neat about this is that it actually has a counter. I don't know if you can see it, but the counter just tells you how many doses you have left. So if you start getting really low, then you want to make sure to call your pharmacy and make sure that they have the inhaler in stock so that you don't run out of medication. Actually, the puffer inhalers have them too. This one doesn't have it, but usually it would have these numbers back here that tell you how many doses you have left as well. All right, so that's my demonstration on the discus. The next one I have is, this is an Ellipta inhaler. So this would be your Inoro inhaler. That's the one that I typically see. There are other inhalers that have this style, but it works very similarly like the discus. So what you're gonna do is you're gonna also make sure that it's in date. And then the way you activate the dose is by pulling this down, and then you hear a click, and then your dose is activated. You wanna hold this like a sandwich too, because it is a powder inside of this medication. You form a tight seal, but what's very important about this particular inhaler is you see these vents here. You do not wanna cover these vents with your finger. You don't wanna cover them with your mouth, because then you might not get the full dose. It might not work. So make sure that you just form a seal right around this area. It's kind of formed for your lips anyway. So form a seal around here, and then you want to hold it like a sandwich. Don't turn it upside down, and put your mouth around it, and then inhale sharply. Hold your breath for 10 seconds or as long as possible. And then that's pretty much it. If you need a second dose, then you'll just repeat these steps. This also has a neat little counter here, tells you how many doses you have left. Once you start getting in the red or single digits, make sure that you call the pharmacy so you can get ready for that new inhaler. The last inhaler that I'll show you is this Respimat. This is actually my favorite one. It's very neat. So I'm gonna disassemble it so that I can show you how to put it together. Just give me 1 second. I can, hold on. There we go. Okay. So when you get your new Respimat inhaler, it would probably come like this with a canister right next to it. So I'm gonna show you how to put this together. When you get the canister, looks something like this. You wanna make sure that it's in date and just check to see if there's any dents or anything like that, any rust. And what you're gonna do is there's a little safety latch right here. You wanna push this down and hold the plastic part of the inhaler, this clear plastic part here, and you wanna pull it apart. So that way it opens this bottom part here where your canister is gonna go. So you take this little canister, you take the narrow end, and then you put it inside of the part that we just took out. And then what you're gonna do, I'm gonna demonstrate it on my hand, but usually you would put it on a hard surface and then you'd press down like that so that the canister is flushed with the bottom, okay? So now your canister is loaded in your inhaler. So the next thing you're gonna do is you're gonna take this plastic piece that we just took off. There's a little slit right here. This part goes up to the safety notch that we pushed at earlier. You wanna just align these two together like so, and then you click it together. So now your inhaler is assembled. So the way that we load the dose is, if you look they're very small, but there's a line here, you see these arrows? these arrows tell you what direction to turn, because this, I'm just gonna show you. So you're gonna take your inhaler, you're gonna turn once in the direction of the arrows, and then you're gonna hear a click, like that. So now your dose is loaded. So once you load your dose, you're gonna open the cap. There's a little lip here that you can just kind of push with your finger. And then this is what the mouthpiece looks like. You're gonna form a tight seal, like all the other inhalers, clear all the air out of your lungs, form a tight seal around the inhaler. It's very important that you do not cover these little vents here, similar to the Ellipta inhaler. You just wanna make sure that you can actually get your dose, so do not cover these vents. And then we have a button right here that actually releases your dose. So you're gonna form a tight seal around the mouthpiece, and you're going to inhale slowly. You don't have to necessarily inhale sharply with this one. This is called a soft mist inhaler. So when I release it, as you'll see now, it comes out like a very soft mist. So when you press the button, you're inhaling at the same time. You hold your breath for at least 10 seconds or as long as comfortable, and then that's it. If you're prescribed a second dose, then you'll have to turn it again to load your second dose, and then just repeat the steps, and then press the button, and then that's it. So those are the most common types of inhalers. There are certainly a couple of other ones. Oh, actually, so some of you might have something called an aero chamber. This is what that looks like. I mean, there are other brands, but this is typically the one that I see. This aero chamber just makes it easier for you to get your dose of medications, because not everyone has the same like suctioning power as others. Their lungs might need a little bit more help. And this you can only really use with the puffer. I'm going to show you how to assemble it and how to give yourself a dose. So the way that this works is when you push the release, it's going to put the medication in here, and then you're just going to breathe normally through the other end. So there's a little like hole right here. You're going to put the mouthpiece of the MDI inhaler inside of it like this, and then you're going to open this end here, and then you're going to put your mouth around here, but you don't have to suck in very quickly. You can just breathe like normal, and you would just push down a dose, and then like all of the air or all of the medication stays in here, and then you just kind of breathe normally. If you need a second dose, then you can do the same thing. So these are very neat. And now a lot of children use this. This is actually the kids version. It has a little mask here because sometimes they can't coordinate how to like put their mouth on this. So they just put their whole face up to this, but most of the adults would use this one. So that is a demonstration of some of the more common devices that at least that I see a lot of patients prescribed. If you happen to have a different type of device and I didn't demonstrate it, then you can actually go to the company website, and they have a lot of videos and a lot of resources to show you how to properly use your inhalers. So I'm going to go back to sharing my screen so that we can see the rest of the presentation. All right, so I showed you the metered dose inhaler, the dry powder inhaler, and the soft mist inhaler. And then I showed you an extra one actually with the Ellipta inhaler. So as I mentioned before, there are a lot of resources for patients who have COPD and or asthma. A really good resource is the Florida Shine program, and it just has a lot of different information about some community events, some counseling on how to use your medications. So I did provide the website link here, which I realize you can't click, but if you wanted to write it down, there's the information there, and there's also a phone number you can use if you didn't want to use the website. So that's it for my presentation. I know I went through a lot of information, but if you have any questions, feel free to reach out to me. I can provide my contact information. And yeah, so that's it. If you have any questions, I would be happy to answer them.
Can you hear me?
Yeah.
Oh, good. My name is David. Hi, Angie. This is I'm a Zoom rookie.
Okay.
So I'm not really adept and I don't know all the protocol to use this system.
Okay.
However, I started on a 4-year clinical trial of Spiriva, and it turned out I was getting the real drug.
Oh.
So I continued that. That started about close to the year 2000, nearly 20 years ago. And then I've tried others. And more recently, I was on Respimat for 2, 3, 4 years, perhaps. And of course, with COPD, it's progressive and my condition continues to get more challenging or deteriorate. And my doctor has now put me on Trilogy. I've been on Trilogy for 3 weeks. I do all the reading, and it kind of freaks me out about all the warnings related to glaucoma, prostate, the thrush, and I think there's more.
Okay.
How much do we know about these contraindications, these side effects, and so on, and whether it's a wise choice for me? Of course, my doctor suggested it, so I got that going. But I'd be interested in hearing your response, and thank you so much for a very efficient and professional, thorough presentation. Extremely knowledgeable. Thank you.
Of course, no problem. Regarding the Trilogy side effects, so Trilogy is a newer medication, and it is used for more advanced stages of COPD. However, as far as the side effects, like the risk of glaucoma, that's more so, that risk is carried with the medication. However, that's more of a rare side effect because it's more for like systemic, if you absorb it so the way that inhalers work, they work more localized. So when you inhale the medication, it's meant to target just your lungs, and it's not meant necessarily to get inside of your system, like inside of your bloodstream in your body and work in other places. However, there is still the risk of that happening, but it's very small usually. Now, with newer medications like Trilogy, there's a lot of post-marketing data that has to be done with newer medications. So we might not know, excuse me, I choked. We might not know the full effects right now at this second, but there's always, like with newer medications, they're always doing post-marketing trials to try to see what other side effects that we might not know about. So I understand your concerns, and they are very, very real concerns, but I would just, if it's working for you, then I would just recommend continuing the medication and just monitoring for any type of side effects. Like if you have any vision changes, as far as the thrush, that's just because of the steroid. That's just the nature of using a steroid inhaler, unfortunately. But as long as you rinse out your mouth very thoroughly, then you shouldn't have that problem. If you do develop that problem, then there are some medications you can take to help treat it. But if for some reason you do develop thrush, then we just might want to go over how you're rinsing out your mouth and making sure that there's not something else going on. So yeah, as I mentioned before, the Trilogy, honestly, I think it's pretty great. Instead of using like all, 3 different inhalers, it just has everything combined in one. But I would just watch out for any type of like information that comes out, like post-marketing data that might come out. So that's how we find out more about any contraindications, just from studies that come out once the medication has been approved by the FDA.
Laysa, can I chime in real quick? This is Bren.
Oh, hey, Bren.
Can you hear me?
Yes.
Okay. My name is Bren. I'm a pharmacist that works with Laysa. So the ocular disease associated with with the Trilogy inhaler, it's primarily related to the steroid component. So there's 3 ingredients in that inhaler, and the ocular disease is typically related to the steroid component. So I was just looking this up in a medication database, and it's very rare. But it says to, just as long as you're getting regular eye exams and you don't have any history of increased intraocular pressure, cataracts, or glaucoma, you should probably be okay. But it's just as long as you have, I would say regular eye exams, they're monitoring for that. You can stop it if you do start having issues. I wouldn't worry too much about it. Just be aware of it. And just make sure to keep your appointments for your follow-up eye exams.
Fair enough. What about, can anybody speak to the whole prostate situation? Obviously, I've got all of these, and there's a warning about urination-related issues. Go ahead.
That might just be related to, so the Trilogy does have that anticholinergic component. And whenever you use anticholinergic type drugs, but this is mostly like when you have that systemic absorption, like I was mentioning before, it can cause like some urinary retention. So that might be what they're alluding to. I'd have to do a little bit more research on that. I haven't heard much about the prostate issues, but I can say that it's probably another really rare side effect that's associated with like your systemic absorption of this medication, but that's not what it's meant to be used for.
Okay, and as far as you know, it's safe or okay to use Trilogy on a daily basis, and then also the rescue inhaler as needed, PRN.
Yes, so using the Trilogy, it's meant for maintenance. So yes, you would use it every day, and it is okay to use with your rescue inhaler because your rescue inhaler is a lot faster acting. So that's something that you would use if you all of a sudden have shortness of breath, if you're doing some type of physical activity. But with the maintenance inhaler, it just kind of keeps you steady. So you want to make sure to use that every day, and it's completely fine to use with your rescue.
Thank you.
You're welcome.
Hey, Liza, we teach our patients in the clinic too that, can you hear me okay?
Yeah, I can hear you.
Okay, that to prevent, so Mr. Franco, what she's talking about with systemic absorption is you want to try to minimize the amount of medication that's going into your whole body. So the way that we teach our patients to do that is to make sure that when you're rinsing your mouth, that you're spitting that water out.
Yeah.
That's a good point, yes.
So lots of patients that rinse their mouth out and then swallow that fluid. And that's the incorrect way of managing that particular medication. So
Right.
My understanding of that anticholinergic effect is with that, with Trilogy, is to avoid it. Mr. Franco, anticholinergics interact with your prostate and kind of block up the flow, if you will. So if you notice that you're not urinating as much or that you're retaining urine, then you should alert your doctor.
Right. No, that's exactly right. So yeah, it's the anticholinergic effect that's interfering with urine output. So, and it's very true when I say rinsing out your mouth, please spit it out. It's not meant to be swallowed. So yeah, rinse out your mouth and then spit it out. Just don't, yeah. But if you do notice any of these side effects, it's a very good point. You want to make sure to reach out to your doctor, and then they'll go from there as far as like assessing what's going on.
Do you guys ever get into a discussion of prednisone?
Prednisone is mainly used when you have an exacerbation. For people who have COPD, we don't recommend routine use of prednisone, only because prednisone does have an effect on your immune system, and it can possibly cause an increased risk of infection. So prednisone is usually only meant for a very short period of time to help with your exacerbation. Typically, you'd be on it for about 5 days or so. If you do have an exacerbation, it just helps with that inflammation that happens.
Right.
Mm-hmm.
Thank you. Yeah.
You're welcome.
Angie,
Yes.
when are we going to go live?
I don't know.
Come on.
It may be a while.
No, can't we sit in a room space?
Soon as American Lung Association gives me the permission, I will definitely start setting up live meetings. You'll be the
Alright.
first to know.
Good. I've been waiting.
Angie and Liza, can we introduce one more education piece?
Yes.
Okay.
When you're using any of those inhalers that require 2 puffs, we recommend that you wait at least 1 to 2 minutes in between those puffs.
Okay, yeah.
Medication to get into the bottom parts of your lungs, gets everything opened up, and then that second inhalation really takes effect in a better way.
Yes, that's absolutely right. Thank you.
This is Michelle, I'm one of the pharmacists too. So I think there's a question about the prednisone, and Angie and I have talked a lot about, because we help with patients that leave the hospital, and a lot of times, people do get put on those prednisone tapers that Laysa had talked about a little bit with when you have that flare up, you may get put on the taper where you slowly go down. But sometimes the taper, if you're on that, if it's not long enough and you're starting to get tight again, at the end of it, we recommend that you call your doctor. If you feel like it's not working as well, just to get that checked out and see if they need to extend it. Usually they try to do a little bit shorter of that prednisone, so you don't have that tightness and rebound, they call it, when you get tight again. But sometimes they try to taper it down slowly, and it may not be quite slow enough for you, depending on how your lungs are doing.
Right.
Does anybody else have any questions or tips, like how you help remember to use your inhalers or anything like that?
You guys have any resources for smartphone apps that help track medications?
I use pieces of paper.
Okay.
No, I have a big chart, and I write down the time that I take my other medications as well as inhalers. So, because one often overlooked item is the relative importance of taking your medications at as close as the same time every day. So, every time I take a medication, I write down the time next to the date, and it's a very good way to track it.
Okay,
The end.
yeah, that's really good. And that works for a lot of people. Like, I'm the type of person that I like writing things down. It just helps me to remember. For those of you who are a bit more tech savvy, I know that using the Outlook calendar helps for me. It just helps me to click on it really quick and make a quick note to myself. There are different note apps. I'm not sure if there's any specific medication timing